So another question we might want to know is, what are the risk factors? What is it that causes some trees to develop this fungal infection that causes leaves to be lost and for the trees to die? And what is it about others that means that they don't? So what are the risk factors? And we could do that by, if we had some idea of what the risk factors were, by following up healthy trees that were either exposed to that risk factor or not. So we could follow up the two different groups and see whether those with that risk factor that we thought was going to cause a problem, whether they develop more fungal infections of the leaves, or whether there was no difference. And that would tell us whether actually that really was a risk factor, that one thing. I mean, who knows here? Maybe it's the position of the trees in the woodlands. Maybe by being outside here on the periphery of the open area, maybe that's a good thing. Okay, so maybe that exposure to sunlight helps to keep the leaves dry, say, and prevent them from getting fungal infections. So if you thought that being on the outside was better than being on the insides of Wimbledon Common, then what you do is you would follow these two groups of trees up and see which ones developed the fungal infections in the leaves. Of course, you start when they're healthy, because otherwise it's a bit problematic. So that'd be a cohort study, and the usual way we do that is prospectively, or the ideal way we do it is prospectively. So we follow those trees forward. Bit tricky to do a retrospective study with these trees, because we don't quite know, unless we had photos of what those trees looked like several years ago. It might be difficult to know that they were actually healthy 5 or 10 years ago, and see whether more of the trees on the outside developed or didn't develop the fungal infection compared to those on the inside. But we could potentially do that. We could potentially look back and see how many of the trees developed it. But one other thing that we can do is we can do what's called a case control study. So what we could do is we could take the trees that have got an infection. Okay, so this one here has got some sort of fungal infections on the leaves. Okay, and we could compare it to, we could take a group of healthy leaves, or healthy trees with healthier leaves. Okay, this one's got something going on it, but it looks like a different fungal infection from that one over there. And what we could then say is, okay, what is it about this? What are the different things that possibly could cause the tree over here to have an infection and the tree over there not to have it? And so this would be called the case. So this is the case group over here. They're the ones with the problem. And then the ones over there are the control. So that's why it's called a case control study. And what it does, if it was a human being, what you'd be doing is you'd be asking this person over here, you'd be saying to them, what have you done in the past that could potentially cause this problem? So you probably ask them all sorts of questions about their exercise, their smoking habits, their exposure to sexually transmitted diseases, whatever it was that you thought potentially might cause problems. You'd also look at, say, the male-female split, for example, and the age and that sort of thing, to see if those were determinants or those were potential risk factors that could explain why one group rather than another group is protected. So that would be what's called a case control study. That gives us some sort of indication about what the risk factors could be, and that then has to be followed up by a cohort study where we actually test that a little bit more by following the patients who are exposed to the things we think are risk factors and seeing whether really they end up with a different amount of disease.